In part 1, I explained why older skin itches, while thinner skin, less moisture, nerves closer to the surface, and why steroids, corticosteroids, and antihistamines don't usually help. Today, I want to get practical. These are the tips and tricks I share with my own patients. They are simple, they are everyday things, but they often make the biggest difference. Reaching that mid-back spot for applying cream, not scratching. That's one of the most common complaints I hear, and it goes like this. Doc, my back between the shoulder blades is always itchy, but I can't get any cream on it. If you live alone, it's even harder. Here's the trick. Get yourself a simple wooden back scratcher or a long ladle. Instead of scratching, wrap a sponge or soft cloth around the end, dab your moisturizer onto the sponge, and use it as an applicator. Suddenly, you can reach that spot and cover it properly with cream. No more twisting and straining. No more leaving that area dry. Patients often come back and tell me, why didn't I think of that before? I'll demonstrate. Okay, let's use a ladle just from the kitchen. Get a ladle, wash it clean, and use it as the extender to scratch. Next, just get a piece of cloth, cut it into size, wrap it around the end like this, tape it around like that, and there you have the plain area where you can apply the cream. Okay, so get some cream and put it on the back here, like that. Rub it in a little. And there you have it, a simple homemade applicator that you can use to reach your back and moisturize difficult areas that you can't reach. You can even use this to apply it on your lower legs, your ankles, your feet, that if you can't bend down to get that area. So very useful tip that can be used easily. And you can just make it up from simple things that you can find at home. Cold creams and ointments put people off. So how do you take the chill of creams and ointments, especially in winter? If you don't apply cream and it's winter, skin dryness often gets worse. The solution is to warm them gently so they feel soothing on the skin. They actually do feel very soothing once you warm the cream or ointment. Here's how you do it. Squeeze out or spoon out an amount that you need into a small microwave safe bowl. Don't put the whole tube or container in the microwave. For about 100 grams, microwave on high for around 20 seconds. Otherwise, do it in 10-second increments. Because microwaves vary, it's safer to start with 10-second bursts. Stir or mix between bursts and check the temperature. Always test it on the inside of your forearm first. It should feel gently warm, soothing, and pleasant, never hot. If you're unsure about using a microwave, just sit the container or tube in a cup or bowl of warm water for a few minutes instead. Patients tell me it makes a huge difference. I've tried it myself, and yes, it's very soothing. Suddenly, this routine will feel comfortable and we are much more likely to moisturize every day, even when it's cold, in a cold winter day. Extra comfort for flare ups. Sometimes even when you moisture regularly, you still get flare-ups. What I mean by flare-ups is not inflammatory flare-ups, but flare-ups of the itch situation, and a sudden wave of itch that drives you to scratch again. For that, there are some over-the-counter anti-itch creams that can give you extra comfort. In Australia, one I often recommend is Dermal Therapy Anti-Itch Soothing Cream. It has colloidal oatmeal to calm the skin and menthol, which gives that cooling sensation. What it really does is it distracts the nerves. Instead of telling your brain, itch, 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 they are telling it, cool, cool, and cool. And that's enough to break the cycle. You can also use oatmeal shampoo, oatmeal body wash, and oatmeal soap. If you're watching from overseas, there are similar products. In the United States, creams like Sana lotion, Eucerin itch relief, or Aveeno anti-itch all work in the same way. In the UK, E45 itch relief cream, Balneum Plus, or Aveeno Dermazac are good options. We can get these also in Australia. They are not miracle cures, but they give that extra bit of comfort on top of your regular moisturizer. Dealing with those stubborn scratch spots. In part 1, I mentioned that some people find their fingers keep going back to the same little spot or lesion. Perhaps it's where an area that you can easily reach. The more you scratch, the harder and thicker that spot will get, and may even break down and turn into a sore. One of the best tricks here is occlusion, simply covering the spot so you can't keep irritating it. The trick is, I recommend using 3M Micropore tape. It comes in skin-colored strips that camouflage nicely. Just apply a longer strip over the lesion. Let me show you. So this is Micropore tape that you can get, white, and this is the skin-colored one that's brown. You may also get that as well from the chemist. So pull a longish strip. Okay, let's say this is the lesion. So get a longish strip and apply over it like that. There you are. And yeah, you can leave that on for days on end. If you don't scrub it, it will stay on. Water, shower is okay. It will still stay on. Trust me, try it out. So as I said, this tape will last for many days. It will hold in place, and it's fine to get it wet in the shower as long as you don't scrub it. This breaks the itch scratch cycle, protects the barrier, and gives the skin a chance to soften and heal. It serves as a second skin you can apply because it's breathable and cream can soak into it. It's also hypoallergenic, hypo for sensitive skin, so it's unlikely to cause an inflammatory response or reaction on your skin. Putting it all together. So here's the routine I suggest. Use a moisturizer every day, a cream for comfort, or an ointment for thicker lesions, thicker spots, and longer lasting protection. Use the practical tips like the backscratcher applicator to get to your mid-back or lower legs, or warming your cream in winter so you can actually use it. Keep an anti-itch product on hand for flare-ups so you can calm things down quickly. And if you've got one of those stubborn scratch spots, try occluding it, covering it with skin-colored micropore tape that you can get from the pharmacy to break the cycle and let it heal. And remember, for most people, these simple measures are enough to manage the itch and keep skin comfortable. If your itch is constant, severe, or interfering with sleep, that's when it's worth seeing a dermatologist. There are stronger treatments out there, but they need specialist care because they come with side effects. I'll finish with this. I know persistent itch can feel invisible. There's no rash, no mark, and nothing to show for it. And it bothers you every day. But you're not alone, and you don't have to just put up with it. With the right routine, simple tricks, the right products, and a few little handy plans, and a few tricks, you can take back comfort and peace of mind. Thank you for listening. I hope it gives you relief.